I want to ask you a question. As a doctor, would you be happy to diagnose pregnancy at the time of delivery? Won't it be a disaster if that were to happen? So unfortunately, in echo, we've been doing something similar for so many years. As you know, LV ejection fraction is the main parameter that we use for assessing LV systolic function. And LV systolic function is something which is very, very relevant for all cardiac diseases. Now, LVEF as a measure of LV systolic function is well established. There are large number of studies which have shown that it has diagnostic value, it has tremendous prognostic value, and it has tremendous therapeutic value also. But the problem is that a drop in LVEF occurs at a very late stage in the development and progression of disease. There are many diseases like hypertension, diabetes, patients receiving cancer chemotherapy, valvular heart disease, coronary artery disease. In all these conditions, LV systolic function becomes impaired first, but there is no drop in LVEF. Now, we are currently relying on LVEF to detect impairment in LV systolic function, and therefore, we are detecting that event at a very late stage. If we were able to detect LV systolic dysfunction at much earlier stage in the progression, it could be really helpful, because then we'll be able to institute corrective measures well in time. So this is something which has become possible with the advent of strain imaging. Now, although the term and the technique appears to be very complex, but actually the current generation equipments and technology has made it quite simple. Today, if you want, you can do strain imaging on your machine while you are doing the echo. Within few seconds, you can get global longitudinal strain, which is the most relevant strain parameter. So many studies have shown that a drop in GLS occurs much earlier than a drop in LVEF. And if you are using GLS, you can detect LV systolic dysfunction several days, years before you could detect it by looking at LVEF. For example, aortic stenosis patient. Now, aortic stenosis has a very long natural history, as we know. Patients remain asymptomatic for a prolonged period of time, but when they become symptomatic, they've already developed sufficient amount of heart muscle damage. If we use GLS, we can detect that ongoing process of myocardial damage at a very early stage, and if we subject this patient to corrective procedures, it may improve prognosis. There are early studies which have shown that it actually happens, although we'll need a longer study which finally confirms that strain imaging based decision making is helpful. And this is applicable for so many other diseases. So I would encourage all of you to start using strain imaging. Do not be fearful of this technology, because as I mentioned earlier, this is not that complicated. Once you start using it, you'll find it very easy. And once you start seeing the benefits of strain imaging, you will be automatically compelled to use it on a routine basis.
GenWorks is here. Together, let's work towards a healthier India.